Peter Kinderman is a professor of clinical psychology at the University of Liverpool and joins me with more on this. Professor, great to have you on the program. What lapses are we seeing in terms of addressing people's mental health during this pandemic?
Okay, well, thank you for having me on. I mean, as everybody is saying, there's a very, very real risk that our mental health could suffer as a result of this crisis, both as a result of understandable fears about the virus itself and infection and health consequences, as a result of the lockdown, especially for people who are in difficult, possibly abusive relationships. And then consequently, when the lockdown is lifted, if there's a major damage to our economies and our social fabric, then that in itself will pose a risk to our mental health. So I think it's right that we're looking at it. It's also the case that mental health services during this period have, of course, been stretched. We've all been shifting to new ways of working, to teleworking, and there's been pressure on the system throughout. So I think that we can expect difficulties. I think there are some reasons to be hopeful, and I think there are some very clear things that we should encourage both health services and also governments to do to protect our mental health.
Right. So what can communities and governments do to help people coping through this crisis, and not even not just during these lockdowns, but once these lockdowns are eased?
Okay, so I think there is general consensus on this, that we need to be mindful to protect our mental health services and to make sure that our mental health services themselves are appropriately resourced. We also need to start looking more widely at issues in the wider society. And I think it would be a mistake if we personalized all of this to think about the individual resilience of one person as opposed to another. I think we need to be thinking of this at a community level. So we need to be thinking about how societies are coming together to support those who've been bereaved, to help people rebuild their lives, to protect people who are in abusive relationships, and especially at the economic and social level, so that I think governments have a responsibility to make sure that people have secure employment, secure housing, and that there are social services available for people who have difficulties in relationships, possibly having their employment or their housing threatened. And although we do need to focus on individual responses to individual distress, I think that at the level of government, we need to be thinking about economic and social protection for our ways of life in order to help us be in the best possible position to then use mental health services or our own individual resources.
Mm-hmm. Why do you suppose it is that mental health always seems to take a back seat, especially in situations like this? Because, of course, we're talking about a lot of the time the symptoms of coronavirus, what happens if you have it and then you've recovered. But, there's a lot of people who won't get coronavirus but will suffer from depression and other mental health issues.
Well, inevitably, this is a crisis, and I think that it's not surprising that our first thoughts are for personal protective equipment, for physical distancing, antiviral agents, vaccines. That's inevitable. I'm not sure that people are suggesting that mental health takes a backseat. And in fact, over the past 20 or 30 years, I've seen massive improvements in our public attitudes towards mental health, the degree to which it's taken seriously at policy levels, and the amount of investment across the world proportionately going into mental health. And the very fact that we're having this discussion is because mental health is one of the frontline, one of the headline discussion points for the World Health Assembly. I think that's good, and I think it reflects the truth behind the slogan that there is no health without mental health. I mean, of course, we're going to focus on emergency medical responses, but no, I think that we have been mindful about mental health all the way through. My one worry is that for some governments, it might be convenient to see mental health as either an individual personal thing for the individual who's suffering from poor mental health, or something to just be left in the hands of the health services. But I think that what we will see in the next few months is that some of the more significant threats to our mental health will come from things like unemployment, loss of income, insecurity, greater social inequalities between people as the economies recover from this challenge. So I think that we need to be sure that governments are protecting our mental health at the societal level, as well as leaving all the responsibility onto the individual.
All right, some really great stuff there. Peter Kinderman, thank you so much.